Hello, good morning everyone. I am Dr. Sreekanth Appasani, Consultant Gastroenterologist, KIMS Hospital. Today we will be discussing about the common gastric problems. In fact, there are various terms which patients give for this particular gastric issue. Some people call it as gas problem. Some people say stomach pain. Some people say heartburn. A few people use a common term known as indigestion. So I'll try to explain what each term means to the patient as well as to the doctor. The first most common complaint is gas. A patient comes and tells the doctor that he has got a gas problem. So what could be this gas problem exactly? It may be an acidity problem where the patient is experiencing excess acid and burning sensation. He feels that it is a gas problem. The patient may be burping a lot, so many eructations happening around, that may be considered as a gas problem. The stomach may be bloated because of excessive gas. He might feel that the tummy is a bit tight with extra gas formation, that is also known as a gas problem. Sometimes non-specific pain, some discomfort lingering around the abdomen is also known as a gas problem, for which it may be a gastric issue, it may not be a gastric issue also. Now, so why does this gas problem happen? What exactly does the patient mean by saying it is a gas problem? The first common complaint which people say is eructations, that is belching. So that's the common term which they use when they refer to it as a gas problem. So this belching is sometimes a disease, sometimes not a disease. If this belching is associated with pain in the chest or burning sensation in the chest or food and some sort of material coming into the mouth or vomiting, that is known as reflux or acid reflux. The food contents or the acid contents of the stomach are coming back into the food pipe, and that's known as gastroesophageal reflux disease. So those burps, those eructations which are associated with pain, burning and vomiting or food particles coming back is abnormal. So that gas problem needs to be addressed and treated. Sometimes people just simply burp after every meal. That may not be a disease. Why? Why? Because when we eat food, when we drink a glass of water, in fact, when we swallow our own saliva, some small quantity of air goes into the food pipe and into the stomach. The same thing comes back as a burp. If you swallow more amount of air, more amount of eructations can happen. So that eructation is a normal physiological process. It is not a disease. We need not go aggressively and try to treat that. Some change in the modification of food patterns like eating slowly, avoiding aerophagia, that is swallowing large gulps of air. So eating small quantities and chewing them properly and gulping them properly sometimes avoids these eructations. In fact, even if we have some eructations or belchings, we don't need to really worry about, unless there is some pain, there is burning, there is food coming back, there is vomiting happening. That is abnormal. That is known as GERD. We need to treat that. But simple burps need not be seriously considered. So this is one of the most common things which patients experience when they refer to as a gas problem. The other gas problem which people frequently complain is tummy being a bit bloated or tight. It does happen to everyone if you eat excessively. Sometimes even if patients eat small quantities, they feel their tummy is a bit tight because of extra gas or extra bloating. So this gas they try to remove in the form of belching, or they try to pass flatus and try to get some improvement out of it. Now they feel that this excessive burps and the excessive flatus passage from below is abnormal, and that is considered to be a gas problem. Yes, it is abnormal in certain conditions. What are those? some conditions which are associated with infections of the intestine. The common one is the H. pylori infection, which can cause ulcers and acidity problem. This can also cause some amount of gaseous distension because of extra gas formation. Second, bacterial overgrowth. There are good bacteria inside everybody's tummy. Everybody's, yours, mine, everyone has got some amount of bacteria, and there is always a balance between the good and the bad bacteria inside our intestines. Now, what happens is, in patients who have problems, either because of old surgery which has altered the intestinal pattern or diabetes or some motility problems where the intestine is not moving properly, there is stagnation of food. The bacteria become abnormal. Normal bacteria are also there, but the bad bacteria empower them. So these bad bacteria, when they increase in the amount, they ferment the food. And that causes extra gas formation. So that patients experience it as bloating, belchings and flatus passage. Sometimes this flatus may also be foul smelling. Now comes a very common condition amongst diabetics: gastroparesis and dysmotility. What are these? In diabetic patients who have bad control on the sugars, we all know that diabetic patients who have bad control on the sugars have their nervous system affected. They all feel this tingling sensation in the feet and the hands and all. That's because the nervous system is affected in those patients. Now, this nervous system which is there inside the tummy also gets affected in these people, and the motility, that is the intestinal movement, becomes hampered. So the food does not move fast, the gas does not empty fast, the stool does not empty fast. These people experience bloating. We call it as diabetic gastroparesis. The other common problem is some sort of disease affecting the intestine, that the intestine has become abnormal. That is, the intestine, which is a free flowing tube, becomes small, narrowed, strictured, twisted. Some sort of movement abnormality happens, and then also the bloating happens. So every patient who experiences bloating needs to be investigated to find out what is the cause of this abnormal gas formation, and then treated accordingly. So this is the other common subset of patients who say they have gas problem. So I have described two different distinct entities. One is the belching problem, which people address as gas. That may be a pathological one like gastroesophageal reflux, or maybe normal physiological when small amounts of air is coming back. The other is this excessive gas formation by fermenting of the food by bad bacteria. So this condition also needs to be investigated and treated appropriately. The second common patient complaint which comes from our gastric patients is tummy pain, tummy cramps. So some discomfort happening is always addressed as pain. What could be this discomfort due to? The common reason is acidity, increased amount of acid being produced in the tummy. Why does this happen? This happens because of bad food habits, eating at abnormal times, missing the breakfast, eating junk foods, lot of spicy and masala foods, not eating on the right time, and stress, anxiety, lack of sleep. These are the common conditions why acidity happens. So this increased acid causes small dots in the intestine, which is known as erosion, or large problems known as ulcers. This can cause pain. Apart from this, gallbladder stones can cause pain, pancreas problems can cause pain, intestine not functioning properly because of poor blood supply can cause pain. So stomach pain is definitely an abnormal thing which needs to be addressed with the help of some investigations, starting with simple blood test, a scan and an endoscopy. Now this tummy pain can be anywhere in the tummy. We give importance according to the location of the pain, if it is above the navel or below the navel. If it is above the navel, whatever symptoms I have described till now, pancreas, gallbladder, liver problems, intestinal problems, ulcers, these are the common reasons. If the pain happens below the navel, most common reasons would be appendix related things large intestinal infections, urinary tract problems like urine infection, gynec related problems, prostate related problems can cause this sort of pain. Kidney stones also cause tummy pain, but the pain is usually in the back coming towards the groin. It's very rare to be there near these areas which I commonly described right now. It's more common in the loin to groin type of pain. So tummy pain happening anywhere should be addressed with the help of a scan and some tests according to the severity of the pain. And no pain should be ignored because it could be a serious problem like appendicitis which needs to be addressed at the earliest. Simple home remedies do work in simple acidity problems when the pain is predominantly in the upper intestine, but any pain which is not subsiding within a few hours, it is better to consult your local doctor or your local hospital or the emergency department to get further tests done, because some pains may be because of some severe diseases like intestinal problems, holes in the intestine known as perforations, ischemia, which is lack of blood supply or decreased blood supply. These are serious conditions which need to be addressed fast. An acidity, simple acidity problem, you can postpone the test by a few days, no hurries. But if there is a perforation, if there is gangrene of the intestine, if we delay the treatment might not be so effective as it has been started earlier. Now comes the third common problem which people say, I have burning sensation. Where do we have this burning? Common reason they say is I have burning here in the chest, in the upper abdomen. Mostly it happens with food intake, especially when I eat non-specific foods, junk foods, non-vegetarian diet, etc. What is this? This is the same thing which I have described, gastroesophageal reflux disease. What is this? Again, I would tell you in detail. There is normal acid which is produced in the intestine. Acid is not abnormal. Acid is a normal thing which is produced in the tummy, which helps in the digestion of food. Now this acid should be there in the tummy only. If this acid comes back into the food pipe, reflux, that is what causes problem. Gastroesophageal reflux. The food pipe is not trained to be tolerating this acid. The stomach is trained. So once this acid comes back into the food pipe starts reacting, creates variable sensation. You might experience burning, you might experience pain, you might experience excessive salivation. Some people don't have all these symptoms, they just have a throat discomfort, sometimes cough, asthma type of episodes, dental problems also. So these reflux episodes need to be treated properly with the help of medications as well as diet and lifestyle modifications. Unless we alter the diet and lifestyle, medicines are not of complete usage. We can't expect that we take a medicine and we can be 100% good and do all the bad things again. So apart from taking medicines for gastroesophageal reflux disease, eat on time, avoid junk foods, and avoid eating heavy masala and spicy type of foods. If you are eating them, eat very small quantities and try to increase the amount of curd and water so that they get compensated. Reduce the amount of stress levels and avoid lack of sleep type of episodes. These help in controlling these reflux episodes to a much greater extent and will decrease your dependency on medicines. Now, the last complaint which always people complain but they do not have a clear idea, indigestion. This is a very vague term. The indigestion means different to different people. For a gastroenterologist it's different, for a colloquial term, for a common man it's different. But over a period of few years of my career, I have understood what people mean by this indigestion. So people mean that they are not able to digest the food properly and that is reacting in some different way. So most common reason they say is the tummy appears to be bloated, again distended. They are not having a feeling of good tummy after they eat food. That is what they refer to as indigestion. That is the same thing as bloating, gas formation, and the treatments as I have previously told you in the earlier part of my talk. Now I would also tell you what other people mean by this indigestion. There are patients who cannot digest food properly and they have some food particles going into the intestine and they can see it in the stool. So this is also known as indigestion. This happens predominantly in people who have problems with the pancreas. People who have their pancreas damaged because of alcohol, chronic pancreatitis patients, have decreased pancreatic juices. So what is the function of pancreatic juice? Pancreas is an organ which is present in the center of the tummy. We all know that is one of the important things in diabetes. Insulin, which controls the sugar, is produced in the pancreas. So that pancreas is in the center of the tummy. It secretes pancreatic juice which helps the digestion of fat and protein. It's a very important organ because the majority of the digestion process which relates to food, that is protein and fat, happens with the help of this pancreatic juice. Now when this pancreas gets damaged and this juice becomes very less, the indigestion happens, and these people tend to pass this undigested food into the stools. That is also known as indigestion by these patients. They express their view in the form of indigestion. Some people call constipation as indigestion. They feel that if they are not able to empty their bowel every day, that is indigestion. So constipation is also referred by some patients as indigestion. So what has the reasons for constipation? Common reasons are lack of fiber in the diet. People not eating fiber rich food. All these processed recent high junk type of foods don't have any fiber in them. So they lead to constipation. Lack of fruits, lack of salads in the diet, not taking water, adequate quantity of water can also cause a lot of constipation. So these words constipation and indigestion are also commonly used by some patients interchangeably. Now, so having explained these 4 words, gas, stomach pain or stomach pain or cramps, heartburn and indigestion, I would like to advise people to come back to the doctor with proper terminology so that you, that is the patient, can communicate the problem properly to the doctor and the doctor also understand it in the proper way. So any gastric issue, whether it is a pain or a burning sensation, should be clearly told to the doctor. If it is a pain, the treatment is different. If it is a burning sensation, the treatment is different. And where exactly is this pain or burning? Is it in the chest or in the tummy? In the tummy, right side or left side? And if you are experiencing gas formation and tummy being tight, that's known as bloating, or you can express to the doctor in the way that your tummy feels tight or bloated after you have the food. Constipation means that you're not passing stool regularly. It may be expressed for different reasons. If you are excessively straining in the mornings and you are not able to pass the stool without much effort, that is also constipation. If you're passing hard rock stools, it is constipation. If you are passing stools once in 3 days or more, probably that is also called constipation. So this also needs to be addressed separately. Now, what are the common home remedies for all these gastric issues? Most of the gastric issues are diet and lifestyle diseases. They are diet and lifestyle problems. They happen because we are not eating the right food at the right time and not having the right behavior. Food, it doesn't mean that we don't eat food at all and live like a sadhu, eating only just a few vegetables or so. No, I don't mean that. We need to have a balanced diet. Oily foods, spicy foods and masala foods, these are the ones which create most of the gastric troubles. So these items should be reduced in quantity and eaten less frequently, once in a week or once in 10 days. So if we maintain this type of diet, generally these do not cause troubles. And more so when you're eating these particular high foods, high spicy and oily or these type of foods, try to reduce the quantity of that particular food item, increase the reciprocating things like curd, fruits, etc., so that you don't have the bad effects of these things. It basically happens that if you eat biryani every day, you're going to have a gastric issue. If you eat once in 10 days or so and have adequate amount of curd, water, milk and fruits on that day, most of the times it is not going to cause much trouble to you. The second common problem is the timing of the food. Everybody is so busy that they don't have time for the breakfast. The breakfast is the most commonly skipped meal of the day, and they have lunch at a very late time like 4 o'clock or so, and a very heavy dinner. Exact opposite should be done for a healthy living. A very good breakfast, or in fact the heaviest meal of the day, should be the breakfast, eaten before 8 or 9 in the morning. Lunch, a moderate amount of lunch, eaten somewhere before 1 o'clock to 2 o'clock, and a very light dinner taken preferably before 8 or 9 in the night. And the last meal and the sleep should be separated by at least 2 hours. So if you can maintain these timings, quantity and proper protocols, most of the times gastric issues will not trouble a otherwise healthy person. The third thing which commonly precipitates is the stress. It may be any type of stress. It may be physiological stress, it may be emotional stress, it may be financial stress, family stress, etc. Or simple lack of sleep because you are overworking or you are having a night shift. Probably that also causes some amount of stress and increases the acidity and the gastric issues also. So reducing this stress with the help of yoga, meditation, having a healthy lifestyle probably puts you back into the gear and avoiding multiple medications for these gastric issues also. So I would like to conclude saying that these gastric issues are predominantly diet and lifestyle related ones. So we need to adapt a very healthy lifestyle, eating appropriate amount of foods at the right time to avoid going into the vicious cycle of continuously being dependent on medicines for these simple gastric issues. Simple gastric issues are not like diabetes and hypertension where you would need lifelong medications. It is whenever you have the symptoms for a very high amount of time, you use it for a finite time, maybe 1 week, 2 weeks, sometimes 4 weeks, 6 weeks, 2 months or 3 months. After that, we should be able to get out of the medications. If you are not able to get out of the medications, there is a problem in the diet and lifestyle. There are very small percentage of people who would still need medications throughout their life for the gastric issues. That is a very small percentage. Rest of the people should be able to manage with diet and lifestyle modifications. Thank you.